Now, what happens when such inflammatory process is going on inside the bone? So, the normal bone will try to encase, will try to limit the progression of all these organisms by the creation of a normally reactive bone formation. And this reactive bone formation is known by the name of involucrum. Alright. So, involucrum is a reactive bone formation, which is a normal bone, which is trying to limit the progression of this inflammatory pathology. So, this is involucrum. What happens over a period of time, that if the organism continues to grow, for example, this is organism, it continues to grow, then it will create a window in this involucrum. All right, it will create a hole in this involucrum. It will create a fenestration in this involucrum, and this hole which is created in the involucrum is known by the name of cloacae. All right, so cloacae is a fenestration or a hole in the involucral wall. Now, just try to see what all being written over here. Now, what is involucrum? It is a reactionary bone around the granulation sequestrum and the organism. Now, you already came to know about what involucrum is. Then, what is cloacae? It is a fenestration or the hole in the wall of the involucrum. Now, imagine when the organisms are have started moving out of this involucral wall, or that means through the cloacae, then it will lead to a creation of a passage, and this passage goes all the way up to the level of a skin. All right, this passage will go all the way up to the level of skin, creating an opening in the skin, and that skin opening is known by the name of sinus. So here it will lead to the creation of a sinus. Now imagine if the patient is having, for example, increased bacterial activity. So it will lead to the formation of the abscess. Now this abscess, because it is having a tract which is made all the way up to the level of the skin, it will lead to the drainage of the abscess out of the skin through that sinus. Also, there is also a possibility that this sequestrum might also come through the sinus tract and might be drained out of the body. All right. So this is represented by a bony spicule coming out of the sinus. So what all being written over here in the sinus, that it is a clinical feature for the chronic osteomyelitis, and sequestrum, sequestrum can come out of the active sinus along with the abscesses. So this is what all are going to be the pathophysiological features for chronic osteomyelitis. Again, quickly, let's have a revision of what we have discussed. First, we have discussed about the sequestrum. You came to know that it is a dead bone which is surrounded by granulation. Second is the involucrum. So it is a normal bone which is trying to limit the expansion of this inflammatory tissue. Third is the cloacae, which is a creation of the hole in the involucral wall. Fourth is the presence of sinus, which is considered to be the only clinical feature for chronic osteomyelitis, through which the abscess can come out, through which the sequestrum can come out. All right. So these are the four histopathological features of chronic osteomyelitis. Now, as far as radiological features or radiological findings for this chronic osteomyelitis are concerned, this MRI will reveal the paprika sign. All right. So it is actually having a rim sign. All these features, the involucrum, this presence of sequestrum, granulation, it will appear like a rim, and that is the reason why it is known by the name of rim sign. Now, the management principle. Now comes the treatment, or what is the management protocol for this chronic osteomyelitis. Imagine a patient is suffering from this chronic osteomyelitis, and here we are having all the inflammatory tissues which are present inside. So this is the pathological cavity which has been created. So what is the ultimate management? Ultimate management is that you have to perform sequesterectomy by saucerization. That means you have to perform sequesterectomy. What do you mean by the term sequesterectomy? Removal of the sequestral cavity or the removal of the sequestrum. How will you remove the sequestrum? By creating a window, all right, and then you remove the sequestrum out. Now, there are two types of the processes, or there are two ways by which you can perform this sequesterectomy. Sequesterectomy is essential because until and unless you don't remove the seat over which the organism is growing, you cannot control the infection. So sequesterectomy has to be performed. But there are two ways of performing this removal. One is that you create a small window and then remove everything out. All right, then you curate everything out. And the procedure B is that you create a larger window and then remove everything out. So this is procedure A, where a small window is created, while there is a procedure B where a larger defect in the bone or a larger cavity in the bone is created. All right. Now, out of the two, which one is likely to be beneficial? Is it procedure A or procedure B? So, majority of you might be thinking that in procedure A, because you are creating a smaller window, because you are removing everything out through a creation of a smaller window, it is much better because you are creating a lesser defect in the wall of the bone. But what in reality happens? Imagine if you go with the procedure A, then in future, if there is a formation of the abscess, then because of the smaller hole that you have created, this abscess is likely to get collected inside the bone in future. But in case, or with the procedure B, in future, if there is a formation of this small amount of the abscess, it will be readily drained out of the bone because of the larger window that you have created. So the better procedure is procedure B in comparison to procedure A. All right. So this is what is important for you to remember. Next is that why is it known by the name of saucerization? You know, the procedure that you are performing is known by the name of saucerization because imagine if this is the cup. All of you know what the cup and saucer is. Now, cup is having a narrow and a deep opening, while a saucer is having a wide, shallow opening. And here, because you are opening a bone in a wide manner, in a shallower manner, you are creating a greater or a wider defect in the bone. That is why it is known by the name of saucerization. So, what is the principle of the management is sequesterectomy, which is performed by saucerization. That is the principle. Now, whether the use of graft is required, whether the use of antibiotic impregnated cement is required, whether the use of antibiotic carrier is required, all right, wax suctions are required, then fixation is required, immobilization is required. All those things are adjectives or simply the additives to the management of the chronic osteomyelitis, because individual disease is managed individually. But the principle remains the same, that you have to perform sequesterectomy by saucerization. That is the management principle, which is common for all the conditions. Then finally, chronic osteomyelitis is an indication for amputation also. You know, in case the chronic osteomyelitis becomes resistant, which is not cured, it cannot be treated anyhow by antibiotics or by the performing the sequesterectomy, long-standing chronic osteomyelitis condition, it can result in, means it can be managed by amputation of that limb also. So chronic osteomyelitis is actually an indication for amputation. One more thing is that a long-standing chronic osteomyelitis condition can also be converted into osteosarcoma. You know, it can also be converted into osteosarcomatous disease. All right. A long-standing infection can be converted into a malignant tumor. That is osteosarcoma. Finally, the last thing which remains in case of chronic osteomyelitis is that already we have talked about, like MRI in chronic osteomyelitis is done for two purposes. One is for the identification of a rim sign, which we have already discussed about. That means condition. Second is paprika sign. Now, what is paprika sign? It is actually the presence of a healthy bone at osteomyelitic site. That means if there is a presence of a healthy bone which was previously occupied by osteomyelitic site, it is considered to be a paprika sign, which is a good prognostic indicator. Suppose you have performed a sequesterectomy, you have gone for the management of this condition, and then you are asking a patient to get this MRI done 6 weeks after the management, and in the region there is no rim sign, rather a healthy bone is present at the site which was previously occupied by sequestrum, it is a good prognostic sign. So it is a paprika sign. That means management is going in a good or a better direction. So hopefully you have understood everything related to chronic osteomyelitis. Now, in the form of the X-rays, what you will get is that there will be a presence of the sequestrum, there could be a presence of the involucrum. All right, all those features could be provided to you in the form of the X-rays, and then they can ask any question related to this particular topic. So the next segment of the question is that what is Brody abscess? All right. So a question is usually a straightforward question. They are just asking that what the kind of infection eponymous name is given to. That is Brody abscess. So obvious answer for that question is subacute osteomyelitis. So let's have a discussion on what is subacute osteomyelitis. What is Brody abscess? It is subacute osteomyelitis. Now, let's have a discussion on what does it mean subacute. Already we have talked about what is acute osteomyelitis, but what is subacute? Just try to understand. Imagine this is a bone, and here we have got the infective pathology which has converted into an abscess because either the host is immunocompetent or the virulence is less, or the organism is less virulent, as a result of which this organism or this infective pathology is not growing beyond the confines of the bone. It is not leading to the cortical thickening. It is not leading to the cortical breakage. It is well confined within the cortical margins of the bone. So it remains unnoticed for a long duration of time. That is what the subacute osteomyelitis is. So what is the reason for the subacute osteomyelitis, or what are the causes for this subacute osteomyelitis? One potential cause is either the immunocompetent host. All right. Either the host is immunocompetent, and the second one is less virulence or decreased virulence of the organism. So these are the potential causes for subacute osteomyelitis. Now you can very easily understand that because the organism is less virulent, it is well contained within the confines of the bone normal host defense mechanism is not allowing this organism or the infective pathology to move beyond the confines of the bone. So it remains unnoticed for a long duration of time. That is what the subacute osteomyelitis or Brody abscess is. But you know what is the controversial question related to this? Now even you can answer this question, that what is Brody abscess? It is subacute osteomyelitis. But you know the controversy which is attached to this is that in 2014 in AIIMS examination, this question was asked like Brody abscess is, and instead of subacute in the options, we had the option of acute, we had the option of chronic, we had the option of acute on chronic and sclerosing osteomyelitis. So obviously, none of the options provided were the answer for that subacute osteomyelitis. But you have to choose one answer. So in order to mark the correct answer out of the two end of the spectrum, that is acute and chronic, you just have to come out with the answer that out of the two end of the spectrum, where this subacute is more inclined towards. All right. Now, as you know that in case of acute osteomyelitis, the condition is very fulminant. The condition is more severe, and that too in a limited duration of time. But in case of chronic osteomyelitis, the infective organism remain unnoticed for a long duration of time. It remains hidden until and unless there is a formation of the sinus which lead to the drainage of the abscess out of the body. So if you keep it inside this spectrum, then subacute osteomyelitis is leading or getting inclined more towards the chronic osteomyelitis. So for that particular question, where there was no subacute in the options, you have to mark the answer as chronic osteomyelitis. But in reality, Brody abscess is the term which was coined for subacute. So in case if you get this as the question and subacute is there in the option, that is the correct answer. That will be your first preference. But in case you don't have subacute in the option, then go for chronic osteomyelitis. All right. Because in some of the guidebooks, it has been mentioned that they are asking that Brody abscess is, and in the options, we are having subacute also, but some of the guidebooks are marking chronic osteomyelitis as the answer, which is obviously incorrect as the answer.